Episodic migraines, occasional headache, nonetheless ubiquitous. With episodic migraines, those affected repeatedly suffer from unbearably severe migraine pain. There are usually short intervals between the individual attacks, but these can be very irregular. But even on symptom-free days, the disease has those affected firmly under control. They are often constantly afraid of the next attack. What is an episodic migraine? In episodic migraines, those affected suffer from migraines at different intervals of up to 14 days a month. It therefore differs significantly from the chronic form in the frequency of the attacks. With chronic migraines, headaches occur on 15 days or more per month. On average, migraineurs have about 2 migraine attacks per year. Only about 8% of patients have more than 3 attacks per month. Most of those affected have phases in which they are afflicted by migraine attacks more or less often. This depends on innumerable internal and external factors. Depending on whether patients suffer from migraines without aura or from migraines with aura, the attacks are accompanied by different symptoms. Characteristic of an episodic migraine are symptoms such as nausea, vomiting and sensitivity to light, in addition to the one-sided pulsating headache. In the case of an episodic migraine with aura, the symptoms typical of migraine can also be preceded by perception disorders such as visual and hearing problems or paralysis of one side of the limbs. Occasional attacks, constant restriction. Even if symptom-free phases are possible in between with episodic migraines, the migraine is still a constant companion, because the next attack can be announced at any time. To prevent it, you should avoid known migraine triggers as much as possible. Try to keep a regular sleep-wake cycle. If you have to get up early during the week, you shouldn't sleep too long on the weekend either. Irregular mealtimes can also be a trigger for episodic migraines. In addition, certain foods or preservatives can trigger a migraine. You have to pay attention to this, for example, when eating in a restaurant or with friends. Stress can also trigger migraines. But there are some measures to be able to cope better with it in everyday life. For example, incorporate occasional breaks in your everyday life, such as a short walk in the fresh air or relaxation exercises. You shouldn't overdo it when exercising. Exercising too long and too hard can trigger a migraine attack. There is nothing wrong with moderate endurance sports, such as walking or yoga. On the contrary, it can prevent migraine attacks. And there are a few things to consider when planning your vacation. What kind of weather is there at the vacation spot, for example? Are there opportunities to withdraw if an attack is announced? These restrictions do not have to apply to every person affected to the same extent, but may require precautionary measures to be observed even during rest periods in some patients.